Good day, everyone. We are Team One, and together with my teammates, we will be presenting an ethical dilemma presentation on our case about consent and refusal to care. So sit tight, and we shall begin this instant. So this case is all about Miss George, a 66-year-old Aboriginal woman who has had diabetes for 35 years, requires an above-the-knee amputation on the left leg as a result of severe ulcers and gangrene. She has a supportive family. She refuses to have the operation, stating, "I was born with two legs and I'll die and be buried with two legs." During her preoperative visit, the healthcare team clarified the rationale for surgery, the positive and negative consequences of her decision, answer her questions, and attempt to alleviate her fears. She is informed and understands the information given. She continues to refuse surgery. Her family says she is irrational and her wishes must be overruled. They want her to have the surgery.
Hello, Mrs. George. How are you?
Hello, doctor.
I checked your chart today and read your history regarding diabetes. Then I consulted your case with another doctor who is a surgeon and discussed with him. We decided to come up with an operation to save the rest of your limb from the infection, which is spreading further. This is to perform above the knee amputation.
What is that, doctor?
As you know, you have a diabetes for 35 years, which damage your nerve vessels in your body. That's why you don't feel any pain, heat, cold, and sharp object on your left leg. We have seen infection, ulcers, and gangrene, as well as I consulted with the surgeon, and they suggest performing above knee amputation.
Do you mean you will need to cut my legs? Above the knee? I don't want it, doctor.
Yes, that's right. Amputation means cutting a part of the legs for your cases. It will be done above the knee to save the upper leg. I know this is a hard to you, but this is the best solution to prevent the further complication. I came here because we can't arrange your surgery for amputation until we have a consent from you.
I was born with two legs, and I prefer and die with two legs.
You already know this must be done. This is for your own good, Mom.
Ma'am, antibiotic don't respond anymore. Once tissue damage has occurred in the form of ulceration or gangrene, it's become more serious and the infection will kill you. We can replace the left leg with an artificial prosthetic, but right now we need to do above knee amputation, and that is the best solution we have. Ma'am, but having your sport and your decision is a key thing to have before any procedure is done.
Okay, doctor. I will think about it again.
Mom, listen. It's just you and me anymore. And I want the best for you. I'm worried about your health, so please, reconsider the treatment.
I know, but I really don't want it.
Please agree with it, Mom. It's the best option for you.
Hello, Miss George. How are you? It's time for your pain medications. Is there something bothering you?
Yes, this is all about the surgery.
Can you tell me more about it?
I don't want my legs to be amputated.
The surgery is important for you, Miss George, to prevent further complications. I know it's hard, but amputation is the best solution for your left leg, as what the doctor have said. Let me give you the room to think. Please take your time to discuss this with your daughter as well. When I come back, let me know what you have decided. Okay? Hello, Miss George. How are you?
Hello, nurse.
Have you decided about the leg amputation?
I do not want it. I was born with two legs and will die with two legs.
Do you want to see the doctor again? And if you have more questions, he can answer and explain it to you more in details.
No need. The doctor told me everything. I know and I understand the procedure, and I am in my best condition until now. I have decided for myself, and I don't want to have the surgery.
I understand. Let me just talk this with my nurse manager.
If this is the case, since the patient is in her full capacity to consent and have decided not to pursue the procedure, we should consult our ethical consultant and the hospital lawyer for this situation.
In this institution, we believe that patients are our partners. We highly respect our patients in regard to our mission, vision, and core values. We always listen to understand both the healthcare team and the patient and her family. We need to fully understand the situation to be able to deliver the best possible care.
Hi everyone, today we are talking about Mrs. George, a 66-year-old woman who has diabetes for 35 years and requires an above the knee amputation of the leg as a result of severe ulcers and gangrene. She refuses the operation and insists that she was born with two legs and therefore die with two legs. Her daughter wants her to undergo the procedure but she still refuses.
What ethical dilemmas we are on in this kind of situation?
We are facing an ethical dilemma on the principle of autonomy. The ethical principles state that the patient's self-determination and perspectives are upheld. Under this principle, the values, beliefs, and opinions of the patients are respected by nurses and other healthcare professionals.
The nurse also should practice being an advocate to the patient by protecting her right for possible misconduct.
I agree. During her pre-operation visit, the physician and the nurse already discussed the positive and negative outcomes of the operation. They also convinced Miss George to undergo the treatment and gave time to decide. They discussed her reasons for refusing the treatment and negotiate so that she can receive the appropriate care for her. We should document their efforts in educating Mrs. George and rationale for recommended treatment and her refusal of care. Most importantly, we should ask Mrs. George to sign a refusal of care form.
I just want to add that according to healthcare consent, consent is required to perform procedure on client, and Miss George is capable to make her decision, and she is aware about the possible consequences. So I think we should not put her under pressure to make decision about her surgery, and we should respect her decision.
Yes, I agree. We should not put pressure on the client and respect her decision.
Yes, we will do that.
And that concludes our consent and refusal to care ethical dilemma presentation. We hope you enjoy it.
Here we are on top of the stars. Never thought we'd ever get this far. We live for moments like this. We come alive in moments like this. Here we are, this is a time, like a dream coming to life. We live for moments like this. We come alive in moments like this. In moments like this. I try to take a breath, thoughts racing through my head. I try to capture it, but a picture can't hold what a heart is feeling. I just wanna stop the world from spinning, slow it all down for a minute, so that I can take it in. I can take it in.